Ashi, can we start?
Okay, yes. Hello, everyone. Very good evening to you all. Thank you so much for joining us today. Um, do we wait for a couple of minutes for the others to join in, or I think we'll wait for a couple of more minutes and let the others join in, and then we can begin with today's session.
Okay, yes. Okay, Ashi.
Hello, everyone.
क्या बताता participation.
Okay, I think we're good to begin. So, a very good evening to all the parents present here. Thank you so much for joining us. A humble request before we go ahead any further. I request you all to please have your mics on mute and unmute only when you have a doubt or when you want to share something. That will make the entire session a little more smoother. So thank you for that. So I would like to take the pleasure of introducing our speaker for the day. So we have with us Dr. Shweta Shinoy. She is an MS in ENT with a fellowship in allergy and a specialization in vertigo. She has her own clinic called the Venti Specialty Clinic at Peta Junction and is also a visiting consultant at VPS Lakeshore Hospital in Nettur and Sangeet Hospital in Matancherry. Apart from medicine, Dr. Shweta also enjoys writing poetry. She is a mother to two, Nidhi and Abhay, and is a wife to Dr. Vivek, who is an anesthetist. So thank you so much for joining us today, ma'am. We are honored to have you taking the session ahead. So without any further ado, I'd like to hand the session over to you.
Thank you, Yashi. Thank you for such a apt introduction of my world in these few sentences. You included all parts of what makes me me. And I'd like to thank Mariam for inviting me here. And it's a wonderful initiative that you all have started here. And like Mariam in the introductory video said, children are problem solvers. But in my talk, we'll know how they are the ones who are going to give us a puzzle for which we have to find a solution. Just let me share my screen. Is it visible to everyone?
Yes.
Yes.
Okay. Okay, so today's topic is about a treasure hunt which the children set us on, the parents and the doctors who are going to be helping them. As we know, children are explorers. There is no doubt about this. If you look at these two pictures, I'm sure their parents are having a difficult time, but don't they look oh so cute? Especially the one sitting in that aquarium and drinking water is absolutely adorable. Having said that, when my kids did the same, I'm sure I would have gone into a frenzy. So yeah, children are explorers. They like to explore new tastes, new structures, new textures, and sometimes this exploration may be a little too dangerous. I'd like to put across that this is not going to be a fear-mongering session. We are going to deal with what can be done, okay, and what as parents should we know that we have to do in order to make things smoother and easier. Now, yeah, in this slide, uh, both these are mine. Both these are my kids. They have done everything possible to make sure the doctor in me is on her toes. So why do children put everything in their mouth? This is a very important question that parents ask us, we ask each other. That is because their mouth is the most sensate part. When they're born with the inherent nature to demand for food, and this is the way the mouth is where they have maximum sensation. So everything they pick and feel, they test it out with their mouth, whether it's the temperature is okay, the consistency, texture, taste, smell. And the question in their head is always, is this food? Am I tasting food? Is it food? That kind of a approach to new things. So as what happens when they are exposed to things which are not foods? The other thing that we need to know is how their grasp develops. You will notice that children who are smaller tend to hold with their palms. And at around 9 months of age, we see them picking with this, like just the index finger and the thumb. This is called as pincer grasp. Okay. So when the child learns pincer grasp, that is when the trouble starts, because that is when these small things reach their hands. Bigger things like this teeter and a cube and a block doesn't really cause a problem. But when they reach pincer grasp, that is when it starts. But pincer grasp is important as well. It is important. Pincer grasp is important because it's a very important developmental milestone. The next is this is what leads to children doing fine motor work. Like even holding a pencil requires quite a lot of hand adjustments. So pincer grasp is very important, but also this is how they pick up these dangerous things and put them in their nose, ears, throat. Okay. When children are born, they do not know any structure apart from their midline. That is, they know their mouth, the head and the trunk, that is all. If you see a child who's around three months, suddenly one fine day he sees his hands and then spends considerable time looking at it and wondering, oh, what is this? Where did this come from? Slowly they learn to realize that, oh, these are my hands. So midline regard comes after a certain age. Also, children have to find their ears and nose. So none of us know that we have a ear on our side. We've only seen it in a mirror. So children find their ears when they play and when they feel their own face. Suddenly they find this structure that is little funny, like a small place where you can put things in. This time onwards, they start exploring. And clearly, yummy smelling crayons and erasers and small objects that look like with these very interesting smells calls for further exploration. So let's just look at the ear. This is the outer ear. This is called a pinna. It goes inside and then there is a eardrum. So when a doctor looks into your ear, this is the limit of what he can or she can see. This is the limit of what your doctor can see. This portion is inside. Unless there is a hole on this drum, you cannot see inside the ear. So what happens when children put things in their ears? Mostly they land up in this region within the canal. So removing it is an easy thing to do, provided it is not very deep inside or it isn't stuck. Towards the inner part of the ear, around this region, the ear becomes narrow. And sometimes when we push things too deep inside, removing also becomes a challenge. So the sound goes from here, touches the drum, touches these three small bones, and causes fluid to move inside the cochlea, and that is how we hear. What do kids put mostly? The commonest thing we have removed is metallic beads, plastic beads, metallic objects. See, look at this. Must be some kind of a pearl-like thing. This is wax inside the ear. The pearl has sort of got stuck in the wax, so removing is easy. So when it is kind of in the center of this line here, in the center of this canal. So removing becomes quite a challenge when it goes deeper in. The other things that we have removed are, these are not what kids have put in, but these kind of go inside the ear because it's a nice place to be. So this is an endoscopy of the ear. So this is the drum. This is the eardrum. And this patient came with complaints of something running around in her ear. So if you can see at that corner, there is a small ant. So these are the things which can go inside a child's ear. I find it particularly more in incidents during cradling ceremony and during ceremonies which involve floral decoration around the child. We have to be extremely careful. Most of these flowers harbor small insects which can go into a child's ear and cause a lot of pain. So I always suggest to keep their bed and beddings clear of all obstructions so that you know what is around the child even when she's asleep. This is a earbud which has gone across the membrane. This is one thing I heavily suggest that nobody does at home, or because there is no real need to clean the ear. Even if you find that your kid has put something in the ear, please do not put a earbud in an attempt to remove, because with such a huge end, it is only going to push it further and not help in removing it. Sometimes kids put pencil and such long and sharp objects inside the ear, and we end up with a tympanic membrane perforation. This perforation is relatively okay because it is going to heal, but if things go too bad, then the middle part of the ear gets affected. So what should we know is that what the child has put in. Organic substances, that is like vegetable matter, seeds, raisins, food particles, or dry fruits, these over a period of time absorb water and swell. So what happens is this entire ear canal gets filled with the organic matter, and also it tends to slowly decay. So this causes far more problem than a plastic bead in the ear. So because it swells over time. Dangerous objects like battery. This is one object that I urge all of you to keep your eyes on, because it is corrosive in nature. The minute it comes in contact with tissue, it starts discharging electrical impulses and creates a huge area of burn around it. And healing from that takes a really long time. If not for anything else, a coin battery and a battery is top one dangerous object on my list. So it has to be removed as soon as possible. Even a delay of 1 hour leads to a large burn inside the nose or the ear, or even the oral cavity, wherever it is. So what happens when kids put something in their ear? First, we determine, is it organic or inorganic? If it is inorganic, like a small plastic bead or a piece of a crayon, it's going to remain there and it can be removed very easily. But when it's an organic substance like a seed, it has to be removed a little as soon as possible, because it kind of swells in the ear. As soon as possible means not in minutes, maybe in a few hours also is okay. Do not try to remove with the earbud, because now you know how the ear canal is. There is no removing with the earbud. There is only pushing with the earbud further. Don't put water and things like that in the ear because these seeds will only swell up and cause more pain. Now, nasal treasures. Nasal treasures are slightly more tricky than than the ear because there is a risk of it going backwards and slipping down. First is we need to assess at what level is it? Is it at the outer part of the nose? Is it deeper inside? Is it way back? So the ease of removing it is different at different levels. If you see it outside the nose, if you see it inside the nose, kindly resist the temptation to try and remove it because there's a high chance you will not be able to remove it, and it just makes the doctor's work more difficult because the deeper it is, the more instrumentation is needed to take it out. So this is a child who came to us with something put in the nose, and it looked like a small earring from outside, but this is a part of it is a small part of that cycle inflating thing. So if it's a metallic foreign body, you can see it on an X-ray. On an X-ray, we cannot see non-metallic, like if it's paper or crayon, we cannot see it on an X-ray. It'll look like it's a part of the nose. So this child came to us with a small metallic piece inside the nose, and this is what was removed. You can see that it matches the structure in the. So what do we gain when we take the scan? We take the scan, we know how deep we have to go. If it is way back or it is towards the oral cavity here, then we have to keep ready a bronchoscope as well, because the chance that it will slip down is higher. This was right in front, but still we needed to give a little bit of sedation and anesthesia to this baby to remove this. The other things that we have removed are buttons are an all-time favorite, and seeds, crayons, thermocol balls, paper, and of the seeds, peanut is the number one, is the main contender for number one spot in children's noses. So we've removed paper, and so clearly how curious and enthusiastic these kids are when it comes to putting something inside their noses. So what to expect when you reach a hospital? So first is that a doctor will see their nose, they'll see their ear, and once they see that there is a foreign body, they will try and assess whether it is comfortable and safe to remove it at that point where they have seen the child, or does it need anesthesia or sedation? Because when we take things out from the nose and ear and the child is already frightened and they suddenly move, it can lead to bleeding and such problems. So we do not want that. So an assessment is done to see how far deep it is, and then with a small vacuum suction it can be removed, or with a forceps or with a small probe it can be gently removed. But if we feel that the child is scared and it is difficult to remove it with the child moving or with two people holding the kid and all that, it's always wise to give anesthesia, sedation, remove it very comfortably with minimum trauma. So what are the dangers of having a nasal foreign body? Is that if it travels downwards into the throat and then to the lungs, because then it's an altogether different ballgame. You have to remove it from the lungs, and that becomes a far more tedious procedure, a bigger procedure. So, and also you have to know that whether they're going to swallow it and then it goes into the food pipe. If the foreign body goes into the food pipe, the management is different. If it goes into the lungs, then the way we manage it is slightly different. So what are the treasures we've removed from the throat? Basically, anything they put in the nose and the ear, they're going to put it in their throats also. But there are some things which we need to really look into. One is a fish bone. Fishbone tend to be very notorious in the sense that there is a lot of pain associated with swallowing a fishbone, which is why the child will not let us examine easily. So finding and getting it out becomes a challenge. Swallowing small pieces of toys, pieces of jewelry, of all this, I find bottle caps very unsettling because they have this round structure and there's a chance that they might just sit on top of the area from where we breathe, causing a block right on top. And this leads, sometimes children stop breathing when these bottle caps kind of go down and get stuck. And of course, food impaction when they eat in hurry burry, or it's when kids take a larger bite than that they can chew, it kind of can get stuck down in their throats. So these are some of the things we've removed from children very interested in eating a biryani that the star anise was inside it, fish bone, of course. So how do we identify, or how does anyone have an inkling that there is a possibility that this child has swallowed something or something is there in this kid's lung? Children they're playing or they're sitting somewhere and suddenly you hear cough and breathlessness in a child who was previously well. So a child who was previously well in the sense they do not have any upper respiratory infection, the child is doing okay. And suddenly there is this bout of cough and breathlessness. That is sort of the hallmark sign of this kid may have swallowed something. So it needs a high index of suspicion, because sometimes if the foreign body is not blocking, after an initial choke and breathlessness, they kind of settle down. But that doesn't mean the foreign body or the peanut or something has gone away. That needs to be imaged. And we image in the sense we need to take a X-ray or a scan and have a look. So if a child right in front of you chokes, what do? An older child or over 1 year, you have to do the HEIMLICH maneuver. So put a thumb, you have to hold the child from back just above the belly button and gently thrust inward so that they cough out. But this is not okay when it's a baby. So for a baby, you have to put the child's face down and gently apply back thrust, turn the child and just compress on the chest as well. So this helps in dislodging anything that is stuck. This is the first thing we can do immediately, especially when it's up in the throat. It really helps. Lower down, deeper into the lung, it may or may not help, but definitely upper airway obstruction gets relieved. So this is some object which has gone deeper and it's in the lung. So for this, we will need to do a bronchoscopy. So bronchoscopy is a small endoscope which is put inside. This is visualized, caught and removed out. So now the question remains, is it in the lung or has the baby swallowed it? Because the trachea is here. This is where we breathe from. This is the windpipe. This is the food pipe. They both are in front of each other. So when it slips down, it can go either ways. So where is the, like in this case, a coin, we decide depending on the imaging. If it's in the trachea, when we see it from front, we see it like a line. If it is in the esophagus, we see a round. So we take 2 X-rays to see it in front and sideways to determine where it is. So what happens? Someone has swallowed a coin or any such thing. The first thing is to distinguish it from a button battery. Some time ago, I think around a year ago, there was this well-known infant death that happened, which was because of a circular foreign body deeper into the stomach. So most likely it would have been a lithium battery. And so once you decide where is it, if it is in the food pipe, then the protocol is different. If it has already reached the stomach, especially a coin, then the inert things, non-harmful things in the stomach, Sometimes we wait for it to pass off. Other thing that we've heard a lot of people say is that they swallowed their tooth. So tooth is tooth kind of gets dissolved or disintegrated in the stomach, else it gets passed in the motion. So it needs a constant check if the child has swallowed something and it has gone comfortably beyond it has gone up till the stomach. But when it comes to airway, there is absolutely no waiting period. So like I always say, prevention is better than cure. Choking hazards are everywhere. Those egg-like chocolates that you get, on one side there is chocolate and the other side is full of choking hazard. So these are the most common things that have been removed. You can see it includes coins, grapes, pieces of toys, caps. Pen caps are another notorious chokers. Some chocolates and these candies, which are very weirdly shaped, they also kind of can get stuck in children's throats. So this symbol of no with 0 to 3 indicates that it is a choking hazard. A child below 3 is not going to understand instructions and is definitely going to try and taste one of these. Food. Yes, we have to prevent choking. When it comes to food, giving children peanuts is a dangerous thing to do. In my opinion, if peanuts is good for health. To give peanuts, you have to crush it and make it into a paste like thing like peanut butter or chutney or something. That is a much easier and normal way to give children. These are the common chokers which we have seen: grapes and these Fruit Loops and stuff like this. Ideally, children shouldn't be eating these things, but anyway, up to age 4, even full pieces of cashew can become a choker. So when we talk about baby-led weaning, we have to be sure that the food is mashed and make it bite-sized, make it chewable, and that should help. Toys, we would have seen these kind of toys. We have to check for leaks. Coin batteries are deadly, as I've told you. I'm a real fan of this kind of a closure, which is a tight closure, provided this metallic screw can also be a foreign body, but at least it involves an adult tightly securing it in place. So yes, so these things have to be very carefully checked. Clothes that the kids wear look very pretty with all these beads, but every other kid is going to pull one off. So their clothing, buttons in front are all invitations for children to try and taste it. Buttons that look like candies have to be really, you have to look into that. So now if a child has put something in a ear, I always have this theory that in the first place, the child must be irritated with something. That's why it found the nearest small object and put it in the ear. So get it checked for any irritation. Is there any wax, allergy, or discharge in the ear? These things irritate the children, and they end up putting something to kind of relieve them from that irritation. Also, frequent ear pulling is one of a sign that there might be something in the ear. So in this talk, my take-home message would be batteries are the worst. Watch for potential small object in your child's surrounding. Organic objects swell with water. Don't ever try to remove with a earbud. And apart from this, something that I have missed to put down in a slide is that medicines look like candies, especially iron. The red iron tablets are very attractive to children. They have to be kept away from children's reach. So thank you. I'd like to take questions from anybody who wants to ask me anything.
Um, just a second. Before we open the forum for question and answers, I would like to take a minute to thank you, ma'am, for giving us such information that I think each parent faces these situations, and it comes with a lot of stress and fear.
I'm
So
sure I've been there as a doctor and a mother, so I know that these things does cause a lot of difficulty in children.
absolutely. So even this sort of support and idea and understanding of what we can do in that minute to make it better can be immensely helpful. So we're really grateful for this help. Um, and I would also like to take this opportunity to just introduce CRINC as an organization to our family, our parents today. So CRINC is an organization which strives to provide unique solutions to parents. It addresses issues such as anger management, time management, building bonds with your children, setting habits in your children, screen time issues, and so on. As part of CRINC's annual membership, you'll be receiving one-on-one mentoring where the mentor will provide unique solutions to your unique needs. It also provides various other benefits that focus on all the three wellness areas of a child, that is their physical, emotional, and intellectual wellness. So to know more, please contact the CRINC team. A link will also be posted in the chat box. So you can access the link where you can know further about CRINC and the membership program. And with that, I would like to hand over the session again to Dr. Shweta, and we can have the questions.
I think there are a few questions in the chat box. One is, how do you suggest we clean children's ears? I suggest we do not clean children's ears at all, because the ear canal is like the skin of the ear canal is like a escalator. It is natural that the skin of the ear canal moves outwards and the wax goes along with that out. When we try and clean the canal, we just push it further and deeper inside. So if you see wax in your child's ear, first of all, wax is not a disease. Wax is that first of all, wax is not a disease. Wax is something that is normally present. Only when it hardens or the child has irritation, it becomes a disease. So you can just clean it, or whatever's on the outside can be cleaned with a towel. Please do not use earbuds in your children's ears. I absolutely do not recommend it.
I'm sorry. Yeah, thank you for that. So, is there any frequency when we should, ideally be cleaning it? Should it be done on a daily basis?
Whatever you see outside after giving your baby a bath, you can just clean it with a towel, but do not put inside the ear, okay? Because the ear self cleans. If you feel that your child is blocking and is having pain, then please get it removed with the vacuum very gently and not with the earbud. Okay.
Okay, right. So only when we see your, irritation, only we clean it. Maybe once in a
Yeah,
week or
correct.
so, it'll be fine.
This is normal. It's just that we've been trained and taught that it is not normal and something has to be done about it. Very few patients we really need to do, who have pain or who cannot hear clearly because there's too much wax, because then we have to address it.
Right, thank you.
I know it feels good, but then I think we should not. Okay, in this era of specialization, why ENT not separated? I didn't get that. Can please ask me that question again? Does it mean, why is ear, nose, and throat a single specialty? Well, ear, nose, and throat is a single specialty because it's actually ear, nose, throat, and head and neck surgery. So this entire thing is one specialty, but now we have divided it further into otology, rhinology, that is ear, nose, throat, and head and neck surgery. And in today's times, ear has gone beyond just ear. It is also neurotology. So things are rapidly expanding. Could you demonstrate first aid done if the child has choked on something. One is the HEIMLICH maneuver for older kids. You have to hold the you just below the sternum, above the belly button, you have to hold a fist and gently push in. And in children, you have to put the child down and tap on the back about 5 times, turn the baby over and press around the chest. I think there is this infographic of this. We'll give it to you and I'll pass it on to Miriam. She can give it to all of you. 11-month-old baby is frequently pulling ear. Is it okay? If it's pulling ear all the time, putting its finger inside, then we'll have to look into it. If there is pain when you touch the ear, you have to see what's happening inside. So sometimes children find their ear and it's a nice thing to play with. That's why they pull it. But just pulling all the while, you may have to look inside. Yeah, so my kid is almost 2. When he plays by himself, he pulls his right ear. So yeah, if any kid is doing that, just look inside the ear and see if you find anything problematic. But sometimes kids just find their ears, so they play with it. But yes, they may have a tight, hard, impacted wax or some irritation inside. Okay, that needs to be seen. How to remove hard wax from a child's ear? Hard wax, you get wax solvent drops. It's called Waxonal baby ear drops. These Waxonal baby ear drops can be put inside the child's ear if there is wax. The hard wax will soften, but once it is softened, if you put a earbud, everything goes deeper inside. It has to be gently suctioned out. My 1-year-old son started to come sort of the nose and the ear as well. Yeah. So this problem, no, my 1-year-old son started having pus coming out from nose and ears. So what happens is, maybe when there is a nose block in children, there is a tube that connects the nose and the ear. When this gets blocked, the nasal infection and the ear infection kind of becomes similar. So because the ear has only that much space, we saw, right? We saw how the middle ear is. So when the middle ear is filled with pus, it has to have a valve to open and come out. That is why the eardrum perforates and the pus comes out. But in children, this kind of perforation heals once the infection settles down. Okay, do we need to take any measure for hiccups? Hiccups is a reflex that happens when there is irritation of the muscle which separates the lungs and the stomach. So this muscle keeps moving up and down when there is some irritation. That is when the child hiccups. If it is too much, it needs to be checked. But sometimes when children eat too fast, they develop a hiccup. My son is always putting finger in the ear as if something is itchy, even on sleep. See, sometimes children do things which makes them comfortable, but sometimes there is an actual irritation in the ear, which we will have to check. Another thing is, when children are fed sleeping, when you breastfeed babies in a lying down position, there's a chance that the milk accumulates in the ear, or also it kind of goes from the oral cavity, from the back into the ear and irritates. Such children tend to have more ear infections that needs to be seen. Okay, 8-year-old most of the time has ear discharge without symptoms. Okay, anyone who has ear discharge that doesn't look like wax needs an examination of the tympanic membrane to see if there is any pus inside. Because if this is not treated, it remains like that, and the eardrum perforation remains still much later in life. only, yeah, if these symptoms are happening again and again, it needs to be checked. Are there any courses, first aid courses offered by any organization? Yes, there is. There is something called as BALS. BALS is basic life support. ACLS is for advanced cardiac, and also pediatric life support. These are the American Heart Association organizes training courses. It is available in many hospitals around Kochi also. In fact, in other Western countries, every babysitter should have a certificate training in handling pediatric emergencies before they can enroll themselves as babysitters. How do you propose to remove chewing gum swallowed by kids? Chewing gum, unless it is in the lungs, it will go off with with the motion. Along with stools, it will go off. But if it is too big and it gets impacted, then we'll have to look into how to remove it. But mostly 90% of the time, it will get downloaded. It's been 2 or 3 weeks, pus is coming out of the nose. So that is very indicative of an infection. If there is non-stop purulent discharge coming from the ear and the nose, this has to be checked. If it is not stopping, we sometimes send a culture to see what is causing the pus. Is it some bacteria which is not healing with a regular antibiotic, and that needs to be evaluated. 4-year-old nose bleeds once in a while. Yeah, children have this habit of nose picking, and a very important vein runs right in front of the nose, especially in children. It's called retrocolumnar vein. And when children put their finger in and kind of manipulate that area, it starts bleeding because that area is very sensitive. Yeah, I think Benazir's question would be that, but if the child is bleeding continuously, or if the child is bleeding from the mouth, or you see he's spitting blood, that needs proper evaluation. We have to see where is it bleeding from, is there any reason, that needs to be checked. But when they put their finger and they cause bleeding, no, that if it is just staining on the tip, it means that they have scratched on that very sensitive part of the nose. The nose outer part is skin, but deeper inside is the same tissue as inside the mouth. So that can get very delicate. So if they kind of scratch on it, the tendency to bleed is there. I don't think you should worry about that. Just cut nails and kind of tell him why that's happening. Probably the child will understand and stop. Because some kids just go on making that erosive area larger, and then it needs actual treatment. So if it's occasional, I think you can reason out with the baby, child. We've answered all. Does anyone, have I missed any questions?
ഞങ്ങളെ വിളിക്കണം വീഡിയോ കോളിൽ ഇവിടെ വിളിക്കോ ക്ലാസ്സിലാ
Have I missed any questions, Yashi?
I don't think so, ma'am. I think most of them are answered. So is there anything else that you'd like to ask before we wind up the session? Is there any other doubts?
I think I saw one, what to do if ant goes inside your ear. It has to be removed because ant comes under an organic foreign body. So immediately you can put some drops, not water for sure, but put a ear drops which will kind of stop the ant from moving around and biting on the tympanic membrane, and then go and get it removed. I showed you a endoscopic video of removing an ant. So yes, but don't put water because that kind of helps in decaying very early. Put any available eardrops on emergency basis, but get it removed. The eardrops, I think, is called autogesic that that you can put, but then unless it's removed, it doesn't solve the problem. Does the nose bleed due to dry weather? Of course it does, due to extreme of weathers. When it is too hot, when it's too cold, what happens is the air goes from the nose. When we take a deep breath, the air is really fast. So when this dry air goes from the nose, it dries on both sides of it dries the inside the nose, which leads to nasal bleeding. Using of air conditioners reduces humidity in your room, leads to nasal block and also nasal bleeding. Is ear discharge a serious problem? I don't think you should worry. It's a common problem. So you need to see why it's happening. And yeah, we need to see why it's happening. And then Mill puts oil plus water when ant goes in. The thing is that you can put anything, but unless it is removed, oil is like a very good culture media for fungus to grow. So if we put oil and water in our ear, you can expect a fungal infection to start soon. If there is an ant, you can come and, I mean, it has to be removed. Sometimes we wash the ear canal and remove, but children don't like that sensation of washing. It needs to be slowly cleaned out. Ishan, what can we do if child swallows something? Yeah, I think we had a discussion on this just now. So if a child swallows something, we have to decide, is it in the lung or is it in the stomach? If it's in the lung, I mean, that gets done only at a hospital level. So if your child has swallowed something, I suggest you you reach to a place where it can be evaluated. If it's in the stomach, we have time, it's not a emergency. If it is in the lung, we need to see what it is and try and remove it as soon as possible. Okay. Yeah, sometimes children have ear discharge. It need not always mean a serious problem. Glue ear is something kids have. So the ear discharge, if it is persistent, and that decides whether there's a problem. I think that we have to see what part of the tympanic membrane has opened, why is it discharging, why is it not stopping is the main question. Okay.
Are there any other doubts before we wind up the session then? I think we have one question in the chat box.
The thing is, what do we do? What should be done on hot weather? I mean, with respect to what? I didn't understand that. Humidifier helps when there is lack of humidity. So that mostly helps during colder seasons, and in a place like Kochi and around here, I think humidity is the main problem. So what should be done in hot weather? Is it for the nasal bleeding question? Yeah, okay. So in hot weather, yes, humidifier may help to some extent. Saline nasal drops help to a greater extent. And yeah, mostly saline nasal drop helps more than a humidifier in hotter weathers. Because humidifier, you have to be around that humidifier but with the saline nasal drops, that keeps the nose moisturized at most times.
Right. Thank you so much again, ma'am, for answering all of these doubts. I think, again, these are concerns that each parent shares with the other. So it solves a lot of issues for a lot of parents here. So thank you so much for giving us your time today. It was a pleasure to have you here at Kring. And thank you so much to all the participants for joining in and contributing to the discussion today. Please stay tuned. Follow our Instagram page and keep yourselves updated with our WhatsApp. We have quite a few workshops lined up for the coming month as well. So I'd like you all to be in touch and we'll keep you in loop.
Thank you. Thank you so much for having me.
Thank you, ma'am. It was our pleasure. The links have been posted on the chat. So I request you all to please check them out as well.
I think those infographics on resuscitation, I'll share it to you. You can forward it to whoever wants. Okay.
For sure. The contact details have also been shared. So please check them out, everyone. Thank you so much again for joining us today. Thank you again, ma'am.
Thank you, Yashi. And thank you, Mariam.